Hello. If you or someone you know and love is diagnosed with and living with multiple sclerosis, you really deserve to listen to this video. My name is Dr. Lonnie Herman, and in just a moment, I'm going to share with you a clip of this patient of mine. His name is James, and he's got to share with you some incredible improvements that he's experiencing finally after years of living with MS, causing devastating damage to his nervous system in his brain and his spinal cord, and causing terrible interruption in his daily activities every day and every night of his life for years. You really deserve to listen to what he's got to share with you, because what he's experiencing now is life-changing. His brain is doing a 180-degree turn, is what he says. So in just a moment, we're going to share with you this video about him. And then when we come back from that brief testimonial discussion with him, I'm going to share with you the kind of exams that I do, the unique exam findings that I helped discover with him that were hidden in his nervous system that no physician he's ever seen in years of living with MS. They've never found these different toxins and infections that caused his MS and could be causing yours or the person you know and love who's got MS. And then near the end of this video, I'm going to share with you a free offer that I think you really will enjoy. And then we'll come to a conclusion, and I'll share with you how to make an appointment to become a patient of mine. Okay, so let's just take a moment. Let's listen to what James has to say. It's incredible, and I'll be back in just a moment.
Before it was at the point that I came to see you the first time, it was allowing me basically to not function anymore. I dreaded even getting up to go to the bathroom, preparing anything to eat, even menial tasks, bending over. I felt like I was going to collapse. I would get into these little spells where it just felt like my head was just filling up and like I was going to black out. Right before I started the second protocol, I noticed, and I just woke up one day and I wasn't experiencing that crushing fatigue anymore. I haven't experienced it since.
And the fatigue you had on a scale of 0 to 10, if 10 is the worst fatigue imaginable, what was it before you started treatment with me?
It was a 10.
It was a 10.
Absolutely. Oh,
and
yeah.
now what do you consider it? You said gone, so
Yeah, zero.
zero.
Sweeping change in just 6 months is totally undeniable. Totally undeniable. I can't tell you how great it feels to regain all of this. It's a gift. It's a blessing. I think I gave you the example on our last visit. It felt like Andre the Giant was straddling my neck, like I was supporting 500-600 pounds of a downward force around my neck. And so hence, you don't want to stand up. You don't want to do anything that requires standing up. It was a living nightmare. Here in the last, let's say 3 years, or when I had to go off work when I was getting bad, I had another MRI, and they basically told me you have transitioned into secondary progressive MS. And the neurologist of Mayo Clinic said, you are one of the most severe cases we have ever seen.
When they said that you're most severe, is because of so many lesions in the brain, or is it because of how you're presenting hard to walk and other malfunctions in the body, or both?
The MRI, basically, they said that from the MRI results. I can honestly say that the change happened discernibly concrete when I started following your protocol.
Positive change.
Positive change, yes. All like everything's headed in the right direction now. And that restored my confidence in what could potentially possibly be out there to get my life back, to turn me around, to get me out of this rut that I've been in for so long. I never found anything that caught on, like something I can honestly say helps, or I do feel a little bit better, or wow, I feel better, until I met you. And I have nothing but hope, and you've restored my hope. You're doing wonderful things for people, and I'm so glad I found you. I was referred to you by a childhood friend who has been a patient of yours in the past, and at that point, I thought to myself, what do I have to lose? Just give it a try. If you're at the end of your rope, if you've given up or wanted to give up or anything, nothing's worked, you've got nothing to lose and everything to gain, and I'm living proof of that.
Awesome. Thank you for sharing that.
Absolutely.
Yeah.
Thank you.
You're welcome. My pleasure.
I'm thrilled. I am absolutely thrilled. I feel like myself again, and I still have a ways to go, and I'll admit it. But what you've given me so far is absolutely profound.
Awesome. My pleasure. I
Thank
love it.
you.
You're welcome. All right, isn't that just incredible? I mean, he has suffered for years with MS, which got worse in 2018, but he's been more than a decade diagnosed with this MS. The doctors told him he is one of the worst cases of MS that they've ever seen. The amount of what they call MS, or the lesions in his brain and spinal cord, causing devastating damage to his central nervous system. And now his life is finally turning around as a result of the unique care, the safe and effective care that I'm offering him. When the immune system, as what medicine says, is attacking the central nervous system and causing demyelination in the white matter of the brain and the spinal cord and the brain stem, and even into the peripheral nerves going down the limb, they're saying that the immune system is attacking the myelin and it's destroying the myelin, destroying your nervous system, and they have to try to stop the immune attack. And in my years of research in immunology and neuroimmunology and in neurology and in neurochemistry and endocrinology and many other parts of the fascinating functions of all different parts of the human body, what I learned in neuroimmunology is that there are different infections, whether they're viral, fungal, bacteria, parasitic, mold. These different kinds of infections can get into your body, and the immune system will attack those infections. The infections are damaging, in this case, myelin, damaging the glial cells that help you reproduce your myelin, damaging your nerve tissue. They can be damaging your bone marrow, your lymph, your muscles, your organs, your glands. They could be in the central nervous system, cerebral spinal fluid. They can be in the meninges. These different types of infections, there could be multiple of these different infections, of different molds, of different fungi at the same time, of different viruses at the same time as the mold and the fungus, at the same time as the bacteria and the parasites. No, multiple sclerosis is not just a Lyme disease caused condition. There could be Lyme disease within a person's body. That's part of the reason. In the neuroimmunology studies that were shared with me when I took that program in my postgraduate studies, every type of autoimmune disease had an infection component to it. Now, there are many studies that I can share with you if you're interested. I'll share with you some different publications. The other point that was brought up to us about causes of these autoimmune diseases are toxins. There are heavy metals. There can be toxins from antibiotics that are in a person's body. There could be chemicals from sedatives and anesthetics that were used in surgical procedures or colonoscopies or endoscopy procedures, taking the tonsils out as a child or a young adult perhaps, a nose job. There can be toxins from like Botox injections, which is a toxin from the botulinum bacteria that can destroy impulses in the nervous system. I can get more into that later. But there's also toxins like heavy metals, like lead and arsenic and mercury, aluminum. Different types of heavy metals can get into the nervous system. We might have been born with a lot of them. These toxins can get into the nervous system, and these metals can actually cause damaging, terrible ill effects on the central nervous system function. I'll actually show you a clip right now next to me of a condition known as Minamata disease. And this condition was discovered in Asia, and this condition, which looks like seizures and looks like Parkinson's type of disease disorder, these people it was discovered that it was a mercury poisoning in their central nervous system that made them have these devastating malfunctions to their nervous system, causing them terrible, terrible damage and terrible. You can just see it's very obvious. They were tremors and they were having seizure-like patterns, and it was terrible. So all from mercury poisoning. So there are many other toxins. There are pesticides, and I can go on a long list of many toxins that are in our environment now. Dental anesthesia chemicals, the mercury fillings in the teeth. Yes, and I'll put links under this video to help you see. There's so many different points that we can make to help you understand about the different toxins, as well as what I said before, the different infections that get into the body and cause devastating effects on the central nervous system and cause a demyelination condition to occur, like multiple sclerosis. There's also activated mast cells or mast cell activation syndrome. These activated mast cells release different highly stressful and inflammatory toxins that are released into the tissues of the body where these activated mast cells exist. I do have a way of going after those or to neutralize those activated mast cells as well. And so with that said, there's a lot of, as I brought up already, toxins, infections, activated mast cells. And one more point I'll make is different inflammatory proteins that can exist in the body that is produced by the body in response to inflammation that already existed in the body. And these inflammatory proteins will exist in tissues and also cause the breakdown of central nervous system tissue and the function specifically of the glial cells. These glial cells that are supposed to clean up your nervous system. The glial cells are supposed to protect your nervous system, repair damaged nerve tissue, and reproduce the myelin. So before I get into the exam findings about James and his remarkable recovery that's taking place under my care, I will tell you what we've got to understand is about the glia, or the glial cells. These glial cells, they protect the nervous system, repair, and reproduce myelin. What would happen? Let me give you an analogy. What would happen if your tires on your car that you've been driving for the past 3 years, the tires got worn out? On all 4 tires, you can see the steel belt coming through, and at any time, it can just burst and you're going to be driving on a flat tire. Or 4 tires are all flat. What would happen if every tire repair facility or tire replacement facility and every tire repair person was on vacation, all the stores were closed, and you couldn't get your tires repaired? You wouldn't be able to drive. In order for you to be able to drive that car again, you've got to replace those tires and be able to now have good tread wear on the tire so that you're not going to A, get a flat, and B, you're not going to drive with a flat tire. And the reason why I'm bringing that up is you have cells called glial cells. As I mentioned a few minutes ago, the glial cells are like those repairmen to replace your tires and retread, if you could, retread a tire. Well, the glial cells do that for your body, for my body, for every person's body. The glial cells reproduce myelin. What would happen when the glial cells, they're not on vacation, but when the glial cells are infected? What happens when the glial cells have a sedative that has been absorbed into the glial cells and they're sedated? What happens when there's an anesthesia chemical that was provided you to do a surgery and the anesthesia chemical got into the glial cells and they are, if you will, asleep, so to speak? What happened if a dental anesthesia chemical that was put into your jaw that numbed your mouth to pull a tooth or drill a filling in, drill in a cavity and put a filling in a tooth, or change the mercury filling to the white filling? That's supposed to be a good thing to do. What would happen? I'm not saying it's a bad thing. That's not what I meant when I just made that statement. But I will tell you that the anesthesia chemical that the dentist put in your mouth, and no fault to the dentist, no fault to the drug company, that's not what I'm saying here, but the chemical that was put into you that's toxic, that will destroy your body's ability to sense anything going on. When your mouth is numb in the dental chair, you can't sense it. And even it can paralyze your tongue. It can paralyze your ability to speak, swallow, spit. If any of you have been in a dental chair and they put that numbing chemical in your mouth, you know what I'm talking about. So when that numbing chemical is in there, 4 or 5 hours later, it starts to, let's say, evaporate or disappear, and you get your sensory back and your motor function restored to your mouth and speaking and swallowing and spitting and so on. Where did that chemical go? Did it just evaporate into thin air? Did you exhale it? Did the numbness go away because you already processed it through your kidneys and it left, when you went to the bathroom, when you urinated? No, that chemical gets into the bloodstream, that chemical gets into your nervous system, and it can travel to the glial cells and impair and stay there like a stain, like a tattoo in the skin, and impair the glial cells' ability to protect, repair your nervous system, and reproduce the myelin. So what happens when they're numb to their proper cause that they're supposed to be doing by reproducing the myelin? They can't reproduce the myelin. Now, is it true, possibly, that the myelin did get an infection on it? Sure. Could you have mold on the myelin? Could you have Lyme disease on the myelin? Could you have a virus like an Epstein-Barr virus, for example, influenza virus that got on your myelin, attacked the myelin, and your immune system can attack that infection that's on the myelin, that's destroying the myelin, and the immune system further destroys the myelin? That's a possibility. I don't think the body just started attacking itself. That's not what I see. And there is a neurology journal called Neurology Journal. When I first took neurochemistry, I'm going to get into his findings in just a moment, but when I first took neurochemistry classes, there was a case that was presented to us published in a journal called Neurology. The patient was in his early 40s, maybe 42, 43 or so years old, and he had lost the function of one side of his body. The arm was worse than the leg, and eventually they did a colonoscopy, but they took a biopsy of his part of his intestine. They found that he had celiac disease, and they suggested he get off gluten, which is not the answer for MS. But the point is, with this one case, when they got him off gluten and it was able to calm down the celiac inflammatory response going on, his whole demyelination syndrome disappeared. The myelin was restored, and his whole paralysis of his limbs was eliminated. He was able to function with the arm and the leg again as if it never occurred. So that was the first sign that I saw that somebody can repair. A nervous system can be repaired. And you all in the MS community, you're aware there is one who's very well known, Dr. Terry Walls, who is no longer suffering with MS. So is it possible that a person can repair their body? The answer is yes. If you've tried diets, autoimmune diet protocols, if you've tried supplements, if you've tried detoxing your body, or heavy metal chelation, or Lyme disease treatments, or whatever it is, and it hasn't worked for you, it's not that it's impossible for you to reverse your disease and restore your health. It's just that you had not used the best method yet to help you do that job. James, as you'll hear in the rest of his testimonial that will be in the end of this video, right now I'm going to get into the exam findings and what we started using to help him get better. James had been through other treatments over the years. He had been through medical and alternative treatments, and through the stem cell treatment that made him worse, and through other types of alternative types of treatments for Lyme disease and so on that got him nowhere, but still again making him worse. And now his life is turning around with my help. So what I'm going to share with you now are the unique exam findings that I discovered when I performed my exams with him. We had to change his diet because there were foods causing inflammation, but it wasn't caused by the food. It was caused by the infections in the organs that were stressed by the foods. Learn more about that on the page about foods and my food type of sensitivity testing that I do in my clinic, and I get very deep into that. And it's actually, there's a bit more. I'm going to share with you something here about the homunculus of the brain. I created a very incredible, deep understanding of the body that we can create a test that's so deep here in my exam room, where I can find, by using the human tongue, nothing strange is going on here, but we can take a flavor like a salt or a sugar, and chocolate or red meat, put it on the person's tongue and see, in this unique method that I've created here, see the body become stressed, and then we can find the part of the nervous system or the organ that's related to that stress from that food, and the infection that's in that organ that caused that organ to be stressed, that further inflames the stress in the body, more inflammation. So when we get rid of the infection from that organ that's tied to the food that we found in this unique homunculus type of study that I do, we'll show you an image of what that is here. When we can find that, it's incredible, because we can shut down the food allergies or sensitivities to the food, so you can have a very well-rounded whatever kind of food you want to eat later on, whether it's a month after you start treatment, or it's 6 months, or it's a year or so. You're going to be able to enjoy foods that possibly doctors who ran food sensitivity or food allergy panels on you told you never touch those foods again. Don't eat gluten, don't eat dairy, don't have blueberries, don't have pineapple, don't have tomatoes. Well, it's just not all true, because when you can get rid of the cause, the infection that's in the organ or in the brain or in the spinal fluid, which we can do with this work that I provide here, when we can find them and get rid of them safely and effectively, without drugs, without antibiotics, without chemicals, you can eat the food again, because the food reaction was really a reaction to the infection that was stressed by the food. Okay, so look into that food page on my website. Also, we did a very thorough dental exam with him, a very different kind of unique dental exam I did with him. I found one of the teeth in his mouth was infected, and he had to get that tooth extracted, which he did for the second exam that he came to me. So the first exam, we'll get into the exam finding now. And let me pause just for a moment. Go to my dental exam page, look through the research that I put up there. It took me over 10 years to compile information, and I'll tell you that the teeth can totally be linked to disease in the body. A root canal a tooth that was extracted in the past. You could have a sinlet abscess in your mouth. There could be an infected tooth that the dentist didn't realize. There could be a filling that's not so good in your mouth that's poisoning your body or infecting your body, causing your MS. Now, the findings. He came to me in February of 2022, and he came back to me in July of 2022. There was treatment during the whole time between the February to July visit. He did all the treatment at home. What I found with him was his lymphatic system. He was poisoned with the chemotherapy chemicals that they used in the stem cell facility in Mexico. I found that he had mold from some water supply that he was consuming. Yes, we could talk more about that later, or personally if I get to work for you and with you. I found the anesthetic propofol in his lymphatic system. I found dental anesthesia chemicals from previous procedures in his lymphatic system. I found residues, chemicals of the tetanus shot he had in the past, stressing his lymph system. I found arsenic, activated mast cells, MMP9 inflammatory protein. I found multiple different insecticides and pesticides and weed killer spray, all of these stressing his lymph system. I found chemicals from the fake cheeseburger from one of the very well known who sold billions of cheeseburgers. I won't use the name here. I'm not here to slander them, but it's a fake cheeseburger. I found the chemicals from that fake cheeseburger food in his lymph. I found a mold toxin called ochratoxin and many other mycotoxins or mold toxins stressing his lymph. I found aspartame, fake sugar, in his lymph. I found midazolam, the sedative, morphine, and lipopolysaccharides, all stressing his lymphatic system. Why was the lymph important to be able to assess? Because the lymph helps to disinfect and detox the whole body, including your central nervous system. I found his glia was also stressed by mercury. The glial cells that reproduce myelin stressed terribly by mercury. How are they going to work well? They can't. I found his kidney was loaded with the chemo agents from that stem cell treatment, multiple molds and mold toxins in his kidneys. I found that a large amount of the tetanus shot in the kidneys. I found activated mast cells and the MMP9 protein damaging his kidneys. I found a bacteria called Yersinia pseudotuberculosis in his kidneys, Brucella bacteria damaging his kidneys. I did a video years ago about Brucella bacteria, a video titled Neurobrucellosis. Neurobrucellosis mimics MS. Very interesting. You might want to watch that. I found the Brucella bacteria damaging his white matter of his central nervous system. What is your immune system supposed to do? Target and kill the infections that are damaging your nervous system. Can that cause demyelination? Absolutely. Listen, when mold gets into a wall, if you've ever been in a house or a building or a school or anywhere where the mold gets into the drywall, you got to cut out the whole drywall. We're not going to cut out your central nervous system, but the point is that mold became into the wall. It damaged the whole wall. The brucella, the Lyme, a virus, a mold can get into your nervous system like that in the drywall, and the immune system is going to attack that tissue. I found Lyme disease infections, the combo of different co-infections and brucella damaging his white matter. I found Epstein-Barr virus at a devastating amount in his glial cells. I found residues from dental amalgam, mercury that he had taken out years ago that was still in his kidneys. I found devastating effects from the polio vaccine, the DPT vaccine, the tuberculosis vaccine, and the MMR vaccine, all stressing his kidneys. We're not going to get into how I do the exam right now. You can, at the end of this video, I'm going to share with you a free offer. There's a video attached to that free offer that you can click on. It's a 42-minute video that gives you a basic understanding, very basic, not in the greatest detail, but some introduction to how I do my work, okay? So that you'll hear at the very end of this video, again, with that free offer I'm going to make to you. He came back to me. Let me tell you, he was feeling not so good. He expected more, he hoped for more, he was depressed, but he had nowhere else to turn or just do nothing and live with the condition and stay in the depressed state that he was in, and the near paralysis and the brain fog and the lack of concentration and focus and annoyed by people and sensitivity to the heat and he couldn't do things with his hands. And so he came back, and it was very interesting because I told him I'd rather he get the tooth that I found diseased in his body. I'd rather get the tooth extracted after he completed the first protocol, not during. He took it out during, and I told him that it's possible he could feel worse from that procedure because the injection put into the jaw to pull the tooth, that chemical and the antibiotic they'll give him can go into parts of his body and poison them and make him weaker. And that's what I found when he came back. He came back. Actually, I used the tooth that was extracted. I got it from his dentist. He brought it to me here. I used that tooth in the second exam. I found where those infections from the tooth travel to parts of his nervous system. Yes, they do. And I was able to help him clean that up during his second protocol. Now, his second protocol, I examined him on July 20th of 2022. And within about a week of him following the steps that we provided him, the unique, safe, and highly effective method, the treatment that we offered him to help him repair his body, within a week of his second protocol, he called me and he was amazed. So excited that you've seen that video. He's in shock. He's so happy because now his brain feels, it's like disease left his brain. And his hands are stronger and his body's stronger and he can handle the heat outside and everything. So he's getting his life back. I found with him in the second protocol, the second exam, I found that he had dental anesthesia from the procedure in the adrenal gland. I found that he had influenza virus affecting his adrenal gland. I found that he had arsenic and dental anesthesia in his white matter of essential nervous system. That's not going to let him function too well. I found the tooth that was pulled had always been infecting his white matter of essential nervous system, where the myelin is. He had dental mercury in the white matter. He had influenza virus. He had the varicella chickenpox virus in the white matter. His glial cells that reproduce the myelin were infected by the infected tooth that was in his mouth. We're getting it out of there in this round. I found that his thalamus, a part of the brain that controls sensation and muscle strength, muscle function, limb function, hand, arm, leg. The thalamus does that for us. We'll show you a picture of where that is in the brain here. I found the dental anesthesia they just used on him was in the thalamus. I found the infections from his tooth were in his cerebral spinal fluid, which is the fluid in and around the brain and spinal cord. I found multiple different mold toxins affecting his brain. I found inflammatory cytokines or interleukins affecting his myelin. I found the kidneys were loaded with the infections from his teeth. That'll make the legs weak. I found the ureters that connect from the kidney to the bladder infected from the tooth. That'll make the legs weak. I found the anesthetic from the dental anesthesia they just performed on him in his kidneys as well. That will make the legs weak. That'll make him not be able to stand up and do certain functions. So we're providing him safe and highly effective quantum energized formulas. There's a page on my website we can point out to you that'll describe that better, but we're using frequencies to target the exact identical frequency of the infection and get it right out of that part of the body where we found it, like the brucella bacteria in the white matter, or the interleukins attacking his myelin, or the mercury in the kidney, or the tooth from his white matter, for example. We can target it with the same frequency. He's living proof, and I'm going to show you right now. Before I tell you any more, I'm going to put up videos of another patient here. We'll put up a few seconds. You can see these videos, and we'll put the links to her testimonial below. I have not been able to see this patient since the COVID lockdown. Canada and US, there's a problem. My clinic is in South Florida, but people coming across the border, they can't now with still the rules with the vaccine. So I haven't been able to see this patient again, but she was able to get feeling in her body back, vision back, short period of time. She was able to get her bladder under control again. She's able to move her legs again that were paralyzed for more than 10 years, able to stand for a while without somebody assisting her. Just incredible. You can hear her speak. The videos are there. This patient, James, is not the only one. It's not just a one luck shot that we're dealing with here.
My name is Judith. I was diagnosed with MS 8 years ago. 5 years ago, the mobility in my legs stopped working, and it hasn't worked since until I saw Dr. Lonnie Herman.
Your knees up, kick your shins up. We're February 27th, 2020 in the clinic here down in South Florida. Okay, Judith, let's see you sit up. It's not happening. So we're going to see it happen now. So try again as hard as you can. That's about it. Okay. The free offer I'd like to make for you is for you to download your free copy of my ebook. And this is how you can help yourself find and rid these disease-causing infections and toxins to help you reverse what they once thought was an incurable condition. I'm going to help you get rid of the causes of your disease and help you fix your body. That is my job, and that's my passion. I love helping people get well, all right? So download your free copy of my ebook, and on the very last page of my ebook, your copy of my ebook, you're going to see there's a link you can click on that will take you to a 42-minute video. I mentioned this a bit earlier. 42-minute video that you can watch and help you understand. I'm going to describe to you my journey as a physician to be the person who will provide you the best chance possible to help you repair your body, restore function in your life. And I get into a brief description of how I'm doing what I'm doing. But again, for some people it's too overwhelming, so I had to make it short, concise. But there's many steps that I've created, many different methods or strategies in my method here that will help me figure things out for you or your loved one who's suffering with MS. Download that book and really start to get some insight here. Click on the other videos that we're going to put under this video. Watch the other testimonials with this other patient with MS who was paralyzed for years and functioning a lot better right now. All right. Unfortunately, insurance, fortunately and unfortunately, I do this work, but insurance does not recognize this type of work. They do recognize the medications that they can provide you. They do recognize MRIs. They do recognize whatever they do, but they don't recognize things that they don't want to believe in or they just don't want to support. So this type of care I'm offering you will be an investment in yourself. This will be an investment in yourself. What's fortunate about this is we have this technology. I've got great knowledge and skill that can help you figure things out for your body. Whether it takes one treatment or two or three or four, it's going to be a lot faster, a lot more rapid to help you restore your life than if you never do this and you try other things. Maybe something else is working for you. Maybe you plateaued with another strategy you used and you want to be able to get beyond because they couldn't figure it out. Maybe there is something else that you tried that did help you some, but you need more. I'm here for you and your family. I look forward to helping you. You can call my clinic at 954-370-3100. Then once again, that's 954-370-3100. We'll put the clinic email address up here as well. You can contact my clinic assistant. You can start to find how you can organize your calendar with ours and get yourself your appointment here, your first appointment here. Also, there's a page on my website called the Frequently Asked Question page or FAQ page. We'll put that link here. Go there. There's a lot of different questions people commonly answer. We've already answered them there as well. I really look forward to helping you because I love when I get to put stories up like James. When I get to put these stories up and show people that it is real, that people can reverse their disease. See you soon. Hi, if you or a loved one has been diagnosed with multiple sclerosis, you deserve to follow and listen to this interview. My name is Dr. Lonnie Herman. I'm going to share with you about a patient of mine. His name is James, who lives here in the United States. He comes to my clinic here in South Florida. He's having an incredible recovery, incredible improvement or restoration of his function deep on a cellular level. So we're going to go over a list of certain symptoms that he's feeling better with now in the beginning of his second protocol, his second customized treatment program that I've designed for him from his examination here in my clinic. And then we will allow him to share his experience of what it's been like for him for many years of living with this horrible, terrible condition and other treatments he's been through that really did nothing for him. So first, one of your symptoms, James, welcome, and I thank you for getting on this call with me to share with people of what's happening for you, positive-wise. One of your terrible symptoms was fatigue, right?
Yes.
And how bad was that fatigue for you before, and what is it like now?
Before it was to the point, and it got that way gradually, but at the point that I came to see you the first time, it was allowing me basically to not function anymore. I dreaded even getting up to go to the bathroom, preparing anything to eat. Even menial tasks, bending over, I felt like I was going to collapse. It was instant upon standing. That pretty much dials it in. If I would stand up, my brain would absolutely tell me, you need to sit back down.
Brain was so tired, did it feel like you were going to pass out? Is that what would happen when you stood up?
I would have spells like that too. Not every time when I stood up, but I would get into these little spells where it just felt like my head was just filling up and like I was going to black out.
Mm-hmm. And so now the fatigue right now is basically what for you? As you started your second protocol, what is it like now?
Actually, right before I started the second protocol, I noticed, and I just woke up one day and I wasn't experiencing that crushing fatigue anymore. I haven't experienced it since.
And is there any fatigue at all right now, or do you feel like really abundant energy happening in your body right now?
I feel like energy's come back. I'm not going to go as far as to say I don't get a little tired. It's when I do, it's kind of almost like a little bit of a heavy tired, like you worked all day or something like, but nothing like what I'm describing as full blown brain fatigue. Like you have no beginning or end to your day. Every moment you're living in is the same moment, and you get nothing accomplished. I was to the point where I it was so bad I didn't even want to have phone conversations anymore.
And you say it was crippling fatigue, right? In the past?
Crippling.
And
Yeah.
now it's not that. And now you don't feel that way.
Nope, not at all. I can distinguish between that fatigue and just being a little tired. Like I've spent time cooking a meal, or I was out in the garage piddling around. I can distinguish between now, and it's gone.
And awesome. And the fatigue you had on a scale of 0 to 10, if 10 is the worst fatigue imaginable, what was it before you started treatment with me?
It was a 10.
It was a 10.
Absolutely. Oh,
And
yeah.
now what do you consider it? You said gone, so
Yeah, 0.
0. The mental clarity, you had that brain fog type of cloudy brain experience, right?
Yeah.
And that was a daily experience for you?
Absolutely.
Before coming to me?
Absolutely.
And now what did you say the last time we spoke, which is just a day ago? What do you say about your clarity of brain? Where is it now?
It's wonderful. It's like, if I had to put it into words, it's almost like the old me's jumped back into my body and my brain. Like I've almost like went back in time to when I wasn't having any problems and carry on a normal conversation just like you and I are right now. Answering a phone call, no problem. Even if it's an annoyance phone call, like a nag call, anything you don't want to answer that's going to be obnoxious and really kind of drain you, I don't have a problem with that now. I used to not even want to answer the phone, regardless of the call. I would get so information used to skew me really bad. If I had to fill out a form or if I had to really think about things, information processing was awful. And I never used to be like that.
Never used to before you started noticing symptoms with the MS, you're saying?
Well, these last 3 years have been the culmination of it. I've been diagnosed for a long time, but it didn't start really hammering me till the end of 2018. That's when I started this decline. That's when it's culminated.
And and you told me on the phone in yesterday's discussion that we had when you were giving me these updates, providing me, how much better you're feeling. You said it was about a 180-degree turn with brain function, right? Or brain clarity.
Yes, absolutely.
Congratulations. I'm happy for you. I'm happy we're doing that for you.
Thank you. I owe it all to you.
Yeah, thank you. You said that there was a stamina that you had, a decrease in stamina for you to be able to do certain tasks around the house or your work or like even mowing the lawn, which you have to sit down to mow the lawn because there is some leg weakness and balance problem, which is starting to get better. But your stamina then to now, what is the difference?
I would say is back to probably 75 to 80% from where it was before the first protocol. That used to be that was almost like right behind the fatigue as one of my major symptoms. I couldn't stay at anything. I couldn't, if I'm peeling an onion, let's say you're peeling an onion to make something to eat, I would frazzle out, but before I even got the skin off the onion, and I'd want to go sit down and close my eyes.
Well, onions do burn the eyes.
Well,
but it was more
true, but
right. But was it more of like you just even doing other tasks, like if you had to like
It was
put away
anything.
the dishes or something? You were just too tired. You couldn't handle it, right?
It was anything. I would just use an onion for an example. It could have been anything. Taking a shower, well, I guess we're talking about brain fog, but if I had to do anything, any task with my eye that requires your eyes, your hands, and your brain to all work in unison, I was done. I was done before I started.
And done being a stamina, like you were just fatigued and you just had to just forget it, give up.
Yes,
And now what is it like for you?
I have like a renewed clarity, and an endurance, a stamina has come back that was basically completely gone before. And it's just remarkable. Like I say, I still have a long way to go, but for only 6 months, this is remarkable. It's like I feel like getting up every day. I feel like attacking the day as much as I can, someone in my physical condition. But baby steps. You got to start somewhere. But this sweeping change in just 6 months is totally undeniable. Totally undeniable. And I can't tell you how great it feels to regain all of this. It's a gift. It's a blessing. Those types of words describe what I'm feeling. Absolutely.
Awesome. I know, congratulations. I know that you also, said like if you went out to sit on the lawn mower and do your, mow the grass, you had to avoid the hot time of the day. You had to do it more at like sundown, sunset time, because the heat would really just like drain you even more.
Yep.
And what is it now for you? Since the energy is feeling better, brain is feeling better, brain clarity function, thought processing, everything is feeling better in that respect. The stamina is better. What is it like for you now when you go out in the heat? Does the heat wipe you out like it used to?
The last few days I've been outside more than I have in quite a while consistently. And one day I did mow the grass, and it takes me about 20 minutes to mow my yard. I didn't feel shook up from the mower like I normally feel. Later on in the evening, like around bedtime, and the heat, and it's been a little humid here and hotter, it didn't bother me. And actually, the sun felt good, normal, like the sun should feel on a human being, not like a burden, and you wish it was down out of the sky because it's killing you. That's how it used to be. And I'm somebody that rode motorcycles for 20 years. It's like I was used to being out in the sun and hot and sunburnt and all this. I was used to it. I didn't really enjoy it too much, but back then it didn't do that to me either. It's just been these last 3 years it's really been crippling and a downward spiral.
And now you feel like it's turning around for you because you're able to handle the sun and not be wiped out in that moment.
What I'm experiencing just in these little things, these little moments, just like mowing the yard, and it's like, well, I could be out in the sun and not be totally wanting to go back in the house to the air conditioning. If this sustains, and I hope it does, it'll be just another blessing. It's like, I don't have to be like a homebody anymore. Stay in, it's hot out. I don't have to worry about like frying out there because my body can't handle it. I can actually go out and be out in it for a bit.
Congratulations. Another symptom that you had was hand dexterity. You were not able to utilize your hands to do your work or other things around the house, right?
Yeah.
And that's been going on, and that was getting worse over the past 3 years?
Yes.
This is August 24th of 2022. When were you first diagnosed with MS?
The year 2000.
2000. So your hand dexterity, was it already losing function prior to the past 3 years, or was it just the past 3 years that you were losing it?
It's been really this past several months to a year as I've noticed my hands slipping.
And now, what does it feel like now?
It feels now, I still get a little clumsy here and there. I'm not saying it's perfect, but it's I notice my brain, hand, eye connection feels like it's back where it needs to be in a manageable cooperation, whatever you want to call it.
It's going to get even better. It's going to get better than where it is. If you can give a percentage rating, if you're able to say it's like 10% better than it was before you came to me, 30% better, how would you rate it if you could quantify it?
At this point, I would say it's probably at least 75% better.
75%. That is
Yeah.
huge. Awesome. You had a cramping and crawling in your legs at night, right?
Yeah, that's
Decrease some?
decreasing. Yes, from what it was. Oh yeah, it's decreasing. It's not totally gone, but it's almost like it's kind of subdued now.
How much less could you say? Could you give a
more,
percentage?
It's more infrequent also. Percentage, I'd say from what it was, I'd say at least 75% probably decreased.
Is that decreased in the severity of it and or the frequency of it?
Both.
Both. Awesome. You had a constipation problem, right? Before
Yes.
coming here. And how frequent were your bowel movements prior to coming to me?
In my worst, let's just back up to probably the year 2020. I was lucky if I went every 5 days.
And was that with any assistance of any kind of like Metamucil or some kind of stool softener or something else? Or was it just that was the average function even without any other assistance?
That's about average, 3 to 5 days. And then, like you say, I was on laxatives, suppositories, things like that to try to help myself, obviously. Now I go about once a day, sometimes twice a day.
And with zero other assistance, correct? No
Zero
laxative, nothing else.
Nothing.
Awesome. You told me that it would be like after 5 days, it would have to be, I'm sorry, we're going to get a little graphic, that it was more like there was a big explosion that had to happen, so to speak, in the bathroom. And now it's all just coming out the way it's supposed to.
You're fine. Oh yeah, it was painful. I mean, it was, I dreaded going to the bathroom for a number two. That's just how it was. I dreaded it. It's like it was a nightmare experience because there's nothing worse than, needing to go and your body doesn't even want to. It don't even want to show up. It's like, nope, you're gonna go through a struggle and a fight again this time, and sit on the pot for 20 minutes or a half hour is ridiculous.
And now you don't have to do that. Now it's functioning the way it's supposed to.
No, if anything, I got to kind of hurry up to get to the bathroom sometime because of obvious reasons.
It's got to come out. Awesome. Good. That's normal function. The insomnia, are you sleeping better at night now?
I'm sleeping really good. I went through a bout of real bad insomnia about a month or so ago. I was really having trouble sleeping a lot, to where I wouldn't fall asleep till wee hours of the morning, and then I'd sleep all morning till noon or 1 o'clock or whenever I would drag myself out of bed. Sleeping seems to get deeper. I'm hitting REM, deep sleep, dreaming.
And staying in a good sleep pattern.
Yeah.
You had another symptom that was with work or with processing information. You had anxiety that would happen. You told me.
Yeah.
Is that happening at all now?
I feel here recently, as all this change has started coming, all this positive change started coming about, that has also gotten very diminished in a good way. I feel like I'm dealing with stressful situations or obnoxious, or where you get a little bit elevated, like nervous or anxiety and all that, like trying to resolve a situation. That's kind of coming to a simmer also, which is great.
Awesome.
Let's put it this way. If this was a month ago or 2 months ago, I wouldn't have even done this call.
Yeah.
There's no way I couldn't. I could not function through it
because of the anxiety, because of the mental stress of dealing with this.
Yeah, it was awful. That was awful too. I used to have like a data entry job, and I had to remember a lot of things, and I did it fine for 18 years. And if you'd have caught me, at any time in this 3 years when I had to leave my job because of my health, I couldn't have gone back and functioned. There's no way. Just pick one reason like that. Remembering things, being clear, focused on what's in front of you and what your responsibilities are, there have been no way I could have even handled that part of it.
And now you're processing information and your mind feels calmer.
I feel back to normal,
Awesome.
like a 180.
Awesome.
I turned around, started going back the other way, and
Awesome.
got there quick because I figured this would be a kind of a more lengthy process or something if I ever got it back. And it's like I just kind of woke up one day and felt different.
It's like a switch flipped overnight and boom, you came back when you woke up.
Yeah.
Yeah, it can be that quick.
Yes.
Your
Nothing-
balance. I'm sorry?
Nothing shy of miraculous.
Yeah. Awesome. Your balance is slightly improved now, standing balance.
Slightly, standing is getting easier. I used to dread it. When I would get up out of my chair, I'd be like, oh, I don't even want to be up on my feet. I'd tell people, my dad, my grandma, anybody, friends, I can barely stand up anymore because I think I gave you the example on our last visit. It felt like Andre the Giant was straddling my neck, like I was supporting 500-600 pounds of a downward force around my neck. Like I was a pack mule or something. That's what it felt like. And so hence, you don't want to stand up. You don't want to do anything that requires standing up. You don't even want to get up out of your chair. And I'm being 100% honest. It was a living nightmare. I never, ever want to feel that way again. I hope to God nobody I know or don't know ever has to experience that. Ever.
Does it feel like when you stand up now that you have that 500-600 pound Andre the Giant on your shoulders?
No.
Does it feel
No.
like there's any extra added weight weighing you down now?
Maybe just a hair, but not. The difference is so from where I was to where I am is so profound and noticeable that I don't even really think about it much now. Like I need to concentrate on my gait, my steps, my balance, getting to the kitchen, getting to the bathroom, not snagging my feet on the carpet or anything like that. That's what I'm focusing on now more since I have been relieved of that burden upon standing.
You did have also, one of the other symptoms was your right hand was numb and the left hand was becoming numb. Last we spoke was July 20th of 2022, just a month ago, a month and a few days ago, before you started your protocol. So is the right hand still numb and is the left hand still feeling like it's getting numb? Does that still feel the same?
Yeah, it is. My right hand is. The left a little bit yet. I don't notice as much change right there yet as I have the other things we've just discussed.
Okay, so that'll come around. You'll get there. I'm glad that we're able to share this list because there is a dramatic difference in the way that your brain is clear and energy is like bound. So the chronic fatigue has just totally disappeared and brain clarity has come back and you're feeling a bit better balance and you're feeling that better stamina. And the anxiety has basically nearly disappeared. You can handle processing information. Your diagnosis with your MS, which is provided back about 20 years ago, you told me was the first diagnosis, right? Was it provided to you, the diagnosis of relapsing remitting back then, or was that later on in your journey?
Yeah, it began as relapsing remitting around probably 2009 or so. I had another MRI. I know that's a long period in between. And I know it's shocking that a lot of people are like, oh my God, you don't go to the doctor, you don't get MRIs, you don't do this. Like, no, I didn't take any infusion drugs that whole time either, or pills or anything of the sort. I've always prided myself in that. But here in the last, let's say 3 years, or when I had to go off work, when I was getting bad, I had another MRI and they basically told me you have transitioned into secondary progressive MS. I've had neurologists and doctors tell me pretty heavy things like, all the holes in your brain. I thought I was walking in to see somebody in a wheelchair. Did you bring yourself here today? Did you drive yourself? Yeah. Oh, I'd have never guessed that. I mean, I've been my current neurologist that I have to retain. I have to, just for certain reasons. He says, you have a ton of MS. You have a ton of MS in your brain and your spine. I was to the Mayo Clinic as I was going off work, and the neurologist of Mayo Clinic said, you are one of the most severe cases we have ever seen. And that's the Mayo Clinic. So that's kind of my story in a nutshell. I mean, everybody can kind of, form their own degree of heavy. I mean, that's a lot for a person to hear, it's a lot for a person to hear.
When they said that you're most severe is because of so many lesions in the brain, or is it because of how you're presenting hard to walk and other malfunctions in the body, or both?
The MRI, basically, they said that from the MRI results. And when I was at the Mayo Clinic, I don't even believe I was wearing a foot bracelet at the time. I was still up and walking. Like I say, I've had other people with MS ask me, how have you had this so long and you're not in a wheelchair, you're not in a walker or anything? I'm like, I don't know. I can't answer that. Just like, what do you say to a doctor that says he thought you would be in a wheelchair when he opened the door, not someone that drove themselves there an hour away? But that's me.
But it affected you terribly. And I remember when I first spoke with you on the phone, the first time before you ever came to me, we spoke and you were, I should say, I mean, there was doubt that it's even possible to start to improve your function and brain function. You were, if it's okay for me to say, there was a very sad state, a very, maybe it's probably depressed state. You tried different things, and you did try different treatments before me. If you want to share what those were, you can.
Sure.
But those treatments very costly as well, and they failed you. And you were at that time, it was just at the end of your rope, basically. And if this doesn't work, it's like throwing the towel kind of discussion. And I came at you very confidently. And I didn't come at you. I was sharing with you in a confident way of why those systems didn't work for you, why the medicines wouldn't work for you, and what has to be done to help you start to get better. And you were hesitant, and I understand why, because there's, you've been to doctors, you've been to Mayo, you've been to some top hospitals, you've seen some top neurologists, you've been to different clinics in different countries as well, spent a lot of money. And you were promised certain things that couldn't really, and they never delivered for you. And here we are now in a 180 of brain function, stamina, and starting to get your balance back, and bowel movements are normal without any assistance. So if you can let people know, people who are listening to this, people who have MS, people who are dealing with this terrible affliction, if you can, let them know in your own words. Obviously, it's very bad to go through this terrible experience, but to shine a light for them, what it was like for you and the treatments that you went through, and all that, the mental anguish, the physical anguish, your family, and now coming here and what it's like for you, because you described to me, I don't remember the exact words that you used, but it's like, this is the answer. So I'll let you speak to everybody here.
Yeah, you're pretty much spot on with what you just said. I've never been one to give up. I persevere. I have patience, even though in the face of suffering, excruciating pain, function loss, brain function loss. Through all this, all these terrible symptoms, having to walk away from a career of 25 years that you loved and you made good money, and all this, 2 motorcycles gone out the window. So much bad has happened in the last 3 years leading up to my decline. And yes, I have taken other approaches. One being, and I'll say it, I have no hesitation about saying it, I underwent HSCT stem cell transplant in Mexico in December of 2020. And it's a procedure that ablates your current immune system that's attacking your nerves whatever, your brain, spinal cord, and replaces it with your own bone marrow stem cells. That was the latest and greatest, and that was about the last thing I had to hang on to. And I had been to a clinic before that who they were into quantum medicine, although they were extremely costly, and they gave you like baby bites to the tune of about $15,000 for 3 weeks. And then they wanted to see you back for more money.
So the treatment from both of those, there was not only no improvement, but you actually felt worse, you were telling me.
Yes, I kept going downhill. It's expected with the stem cell. They say you go into a valley or a dip, and you go down before you go up, and that can last anywhere from 1.5 to 3 years from some people.
And for you, the dip was in bed, and you were barely getting out of bed, you told me.
Absolutely, it was ridiculous. And I can honestly say that the change happened discernibly concrete when I started following your protocol.
Positive change.
Positive change, yes. All like everything's headed in the right direction now. And that restored my confidence in what could potentially possibly be out there to get my life back, to turn me around, to get me out of this rut that I've been in for so long. And everything that accompanies it, when people get in this low state of existence, everything's been stripped of them. They can barely function. Yes, your mind tends towards the dark. It does. I don't care. It's almost unavoidable. And I was at that point, and I was at rock when I came to you. I was at rock bottom, and I had very good reason for being there, as I'm trying to convey, and I've always known that there, in my greater sense, I've always known that there are ways to do anything. And I felt like I had dedicated way too much time and money to more traditional approaches, some not so much, like the stem cell. But I never found anything that caught on, like something I can honestly say helps, or I do feel a little bit better, or wow, I feel better, until I met you. And I have nothing but hope, and you've restored my hope. You've put my confidence back in a real human being that wants to help others. I know that may seem few and far between these days, but you're doing wonderful things for people, and I'm so glad I found you. I was referred to you by a childhood friend who has been a patient of yours in the past, and at that point, I thought to myself, what do I have to lose? What do I have to lose? I know Ryan probably wouldn't steer me wrong or lie, or he's telling me this for a reason, and I'm so glad I pursued him giving me your phone number. Because I would hate to think where I would be right now if he had. Period. The
Right.
end. I mean, that's about as much. I know I was long-winded, but I have a lot to say. I've had 3 years of being kind of bottled up and to my own prisoner of my own thoughts. And your clearer mind. Everybody has a clearer mind. You just have to get in tune with it. You have to believe. You have to dispense with some things like the traditional, these traditional routes. There's a motivation behind them, and it's not so much for you or you getting better, or you getting your life back, or you riding a motorcycle again, or you going back to work again someday, maybe. It's not that. And we don't need to get into talking about it because
we're not talking about it. But what you've seen, the difference from that work, even the stem cell with the chemo and the other types of treatments you've taken, and you were on no treatment when you came to me. There was no MS medication. You were on nothing when you came to me, right?
Correct. I've always shied away from those infusions and everything else.
But there was no other treatment when you came. Nothing.
No.
You were done with everything else, and now you're seeing your life come back to you. And you also mentioned something that it's like with this, and I will say with great pride in my work, it's like a precision based. You can find exactly what the cause is and neutralize that cause out of your body, wherever it is, the brain and the lymph, wherever it is. Right. That's what you're recognizing with this.
Targeted.
You start to feel the changes take place because you know and when you know what you're treating as well. And there's no placebo effect. It's very obvious what you're dealing with.
Yes, it's very targeted, and it's just incredible at the speed and the accuracy of your methods and your exam. It's like nothing I've experienced before.
Mm-hmm.
This makes me want to go on and see how much better I can get.
And there's going to be more.
But just the fatigue gone and all these other symptoms that have just shriveled up almost like overnight and disappeared are a blessing, a total blessing. And it's like it's just so, it's profound is what it is. If there was a word, it would be profound. You don't hear about things like this. This is what miracles are made of. To experience it is quite something. And I would recommend anybody give it a try. Just give it a try. If you're at the end of your rope, if you've given up or wanted to give up or anything, nothing's worked, you've got nothing to lose and everything to gain. And I'm living proof of that.
Awesome. Thank you for sharing that.
Absolutely.
Yeah.
Thank you.
You're welcome. My pleasure. With your permission, because I'm going to transition to another video. And with your permission, I'm going to share the exam findings, things that I discovered in you from, like mold and other kinds of things like that I discovered. If you're okay with that, to let everybody know. Yeah. And,
Sure.
And I'll even tell them, what our experience was, if you're okay, because we had to get some dental work done and some things. Because when you came back after your first protocol, when you came back for your second exam with me, you were very depressed. You were feeling weak. You were actually feeling worse, right? And now you're feeling dramatic improvement. So I'm going to describe for them as well why that happened. But now we're seeing the light. Now we're seeing the light through the tunnel, right? As however they put that saying, that cliched statement, we're seeing the light at the end of the whole stress there. So, and I appreciate you sharing this with everybody here. They appreciate you too. I'll send you this video when I've gotten it done. And if you want to share this with other people who in the MS community who you've become connected with over the past few years. And I'd also, as we go along in this journey together, when you come back for the next, after this protocol that you're following now, I'd like to be able to get another video and progress, videos as we progress through the care.
Absolutely.
Yeah.
I'd be all for that.
Awesome.
It would be a small thing that I could do for the amount of what you've given me back. Let's put it that way. It would be pretty much peanuts. It would never be any kind of repayment from what you've just given me in the last 6 months. Not even close.
Awesome. I'm so happy for you.
I'm thrilled. I am absolutely thrilled. I feel like myself again, and I still have a ways to go, and I'll admit it. But what you've given me so far is absolutely profound.
Awesome. My pleasure.
Thank you.
You're welcome.